Formulas that tonify. First formulas that tonify the chi. First formula, C. Juntitang, 4 gentleman decoction. All ingredients. Renshin, 3 to 9 grams. Baiju, 6 to 9 grams. Fuling, 6 to 9 grams. Jigansao, 3 to 6 grams. Tonifies the chi and strengthens the spleen. Indications are pale complexion, soft and weak voice, reduced appetite and loose stools, weakness of the limbs. The tongue is pale and the pulse is deficient or frail. This is the typical chi deficiency or spleen chi deficiency symptoms caused by improper diet, too much thinking, or overworking. Some cautions and contraindications are for long-term use may result in a dry mouth or thirst or irritability. Modify if you use in patients with high fever or heat from deficiency or a combination of irritability, thirst, and constipation. Use this formula for the following Western illnesses. Mostly digestive system troubles such as chronic gastritis, peptic ulcer, IBS, chronic hepatitis, or to reduce recovery time after gastric surgery. Can also use for some anemia or neutropenia. Can also use for fever of unknown origin or recurrent nosebleeds, especially in children. Some modifications are for indigestion with reduced appetite and abdominal distension and weight loss, add shangfu and hopu. For morning sickness, add sha ren and chenpi and hopu. For edema during pregnancy, take together with wu pi yin. For periodic paralysis, add huang qi, mai mendong, bai ji, and feng feng. For uterine fibroids, add Iju and Sanleng and Nu Shi. For palpitations and insomnia, add Suan Cao Ren. Shenling Baiju San, ginseng poria and white attractor lotus powder. All ingredients. Renshin, 1,000 grams. Baiju, 1,000 grams. Fuling, 1,000 grams. Jigansao, 1,000 grams. Shanyao, 1,000 grams. Biandu, 750 grams. Lianzi, 500 grams. Iiren, 500 grams. Sharen, 500 grams. Jigang, 500 grams. Grind ingredients into a powder and take each in 6-gram doses with warm water. Augments the chi and strengthens the spleen, leaches out dampness, and stops diarrhea. Indications are loose stools or diarrhea with reduced appetite, weakness of the limbs, weight loss, distension, a stifling sensation in the chest and the epigastrium. Pale complexion. Tongue is pale with a white coating. Pulse is thin or moderate or deficient. Possible indications also are vomiting. Some cautions and contraindications. Use this with caution and only after significant modification in cases with concurrent heat from yin deficiency. This formula is prescribed to treat diarrhea at the beginning of menstruation. It is also used to treat leukorrhea in relatively obese women with edema and spleen deficiency signs. It is also used for treating proteinuria in patients with Chi deficiency and edema. And can also be used to treat chronic gastritis, enteritis, and gastrointestinal side effects of chemotherapy and radiation therapy. Other uses are irritable bowel syndrome or IBS, chronic hepatitis, chronic bronchitis, chronic nephritis, and anemia, diabetes mellitus, and malabsorption syndromes, and malnutrition in children. Some modifications include for interior cold with abdominal pain, add ganjang and rugwe. For less appetite, add shanja and shenchu and maya. For coughing up copious watery sputum, add chenpi and bansha and qingren. For a dusky yellow color of the skin and eyes, add sini sun. For diabetes mellitus, add huang qi and wu wei zi and jinei jin. For proteinuria with edema and spleen qi deficiency, add huang qi. Bu zhong yi qitang. Tonify the middle to augment the qi decoction. All ingredients: huang qi 12 to 24 grams, renshen 9 to 12 grams, baizhu 9 to 12 grams, jigansao 3 to 6 grams, wine fried or wine washed dangwei 6 to 12 grams, chenpi 6 to 9 grams, shengma 3 to 6 grams, chai hu 3 to 9 grams. Tonifies the middle burner and augments the qi, raises the yang and lifts sunken qi. Indications. This formula treats 3 different patterns. Number 1, spleen and stomach deficiency. Number 2, qi deficiency fever. Number 3, sinking of middle burner qi. The indications of the first, spleen and stomach deficiency, is dizziness, unclear vision, deafness, tinnitus, shortness of breath, laconic speech, weakness of voice, a pale complexion or a shiny and pale complexion, loss of appetite, loose stools, the tongue is pale, and the pulse is frail. The indications for number 2, the qi deficiency fever, is intermittent fever that is worse on exertion, or spontaneous sweating, or aversion to cold, or a thirst for warm beverages. Tongue is pale and swollen. Pulse is large and forceless. Number 3, sinking of middle burner qi. Indications are hemorrhoids, prolapse of the rectum, prolapse of the uterus, prolapse of internal organs, or chronic diarrhea or dysentery, irregular uterine bleeding, loss of appetite, loose stools. The tongue is pale and the pulse is deficient and soft. Cautions and contraindications are contraindicated for fever due to heat from yin deficiency. Contraindicated for patterns that are rooted in deficiency of the lower burner. Mainly the symptoms for this formula tend to be chronic and accompanied by middle burner qi deficiency and spleen qi sinking. Other indications are failure of middle burner qi to assist the spreading of protective qi in the upper burning, leading to aversion of cold and spontaneous sweating. Also, other indications are bleeding from the lower part of the body, including diarrhea and also urinary incontinence and premature ejaculation, indicating the sinking of the qi. Other indications for the sinking of the qi is the inability of yang qi to lift up, leading to tinnitus and visual disturbances and dizziness. Use this formula for the following Western medical illnesses: chronic bronchitis, chronic rhinitis, ulcers, chronic laryngitis, used for side effects of radiation treatment, or fevers of unknown origin, used for prolapsed uterus, prolapsed rectum, hernias, used for stress incontinence, myasthenia gravis, primary hypotension, and constipation due to decreased peristalsis. Used for dysfunctional uterine bleeding and leukorrhea. Can also be used for postpartum urinary incontinence, recurrent miscarriages, infertility in both men and women. Can be used for corneal ulcers, cerebral arteriosclerosis, Alzheimer's disease, pernicious anemia, paralytic strabismus, leukopenia, chronic nephritis, and the side effects of immunosuppressive drugs. Some modifications are for painful urinary difficulty in the elderly, add xixie and mutong. For constipation due to spleen deficiency, add honey and sesame oil. For bulging disorder, add juhe and xiaohushang and lijihe. For enuresis in children, add sung piaoxiao and yi ren. For chronic rhinitis, add keng erzi and xinyi hua. For corneal ulcers, add gujing sao and jue min si and shan yao. For abdominal distension, add jishi and hopu and mushang and sha ren. For leukorrhea, add kangju and huangbai. For tinnitus and diminished hearing, add shanjuyu and yiji ren. For vertigo, add xuansheng and jiban sha. For diarrhea, add mushang. For severe pain, add shi shin. For headache at the vertex, add gao ben. Sheng Mai Sun, generate the pulse powder. All ingredients: ren shen 9 to 15 grams, mai mendong 9 to 12 grams, wu wei zi 3 to 6 grams. Augments the qi, generates fluids, preserves the yin, and stops excess sweating. Indications are chronic cough with little sputum, difficult to expectorate, shortness of breath, spontaneous sweating, dry mouth, dry tongue. Tongue is pale or red with a dry thin coating. Pulse is thin and deficient or rapid and deficient. This formula is for both deficiency of qi and yin, primarily of the lungs. The This is also used for summer heat stroke or heat stroke. And this is where the pulse will be deficient and rapid due to the pathogenic heat. Some cautions and contraindications are: use caution in high fever, and also use caution where the pathogen has not been resolved. This formula should be used for the following Western medical illnesses: cardiovascular system illnesses such as coronary artery disease or acute myocardial infarction, myocarditis, arrhythmias, congestive heart disease. Can also be used for various types of shock. Used for pulmonary system illnesses such as bronchitis, pulmonary tuberculosis, and cardiopulmonary disease. Used for acute infections, sunstroke. Can be used for senility, scleroderma neonatorum, and neurasthenia-like disorders. Some modifications are: for severe coughing, add Kwandonghua and Bai He. For irritability, add Suan Cao Ren and He Huan Pi. For palpitations, add Guiji and Longgu and Muli. For coronary artery diseases, add Shigan Sao, Dan Shen, Honghua, and Qi Shao. Formulas that tonify the blood. Siwu Tang, 4-substance decoction. All ingredients: Shu Di Huang, 9 to 21 grams. Bai Xiao, 9 to 15 grams. Dangui, 9 to 12 grams. Chuan Xiong, 3 to 6 grams. This formula tonifies the blood and regulates the liver. The indications are dizziness, blurry vision, pale and lusterless complexion, pale and lusterless nails, generalized muscle tension, insomnia, palpitations, thin body, irregular menstruations with scanty flow or amenorrhea, periumbilical pain or lower abdominal pain, menorrhagia, hard abdominal masses, restless fetus disorder. The tongue is pale. Pulse is thin and wiry or thin and choppy. The indications are primarily a generalized blood deficiency or liver blood deficiency, so dizziness and blurry vision, etc. Some cautions and contraindications are: should not be used in treating severe or acute blood loss or severe weakness or labored breathing. Use this formula for some of the following Western medical illnesses: primary dysmenorrhea, irregular menstruation, threatened miscarriage, postpartum weakness, insufficient lactation. Also used for allergic purpura, neurogenic headaches, urticaria, plantar warts, but primarily anything related to obstetrics and gynecology. Some modifications are: for restless fetus disorder with bleeding, add Aye and Erjiao. For signs of heat, remove Sheng Di Huang and add Shu Di Huang and Huang Qin and Mudan Pi. For more qi deficiency, add Ren Shen and Huang Qi. For blood deficiency with internal cold, add Wu Gui and Wu Zhu Yu. For blood deficiency and cold in the womb, add Aye and Shang Fu. For a short menstrual cycle with steaming bone disorder, add Digu Pi and Mudan Pi. For dry and itchy skin, add Feng Feng and Zheng Jie. Dangui Bu Shui Tang, Dangwei decoction to tonify the blood. All ingredients: Huang Qi 30 grams, wine fried dangwei 6 grams. Tonifies the qi and generates blood. Indications are hot sensation, red face, irritability, thirst with a desire to drink warm beverages. Tongue is pale, pulse is large, flooding, and deficient. Other indications are fever and headache due to loss of blood. The indications are mainly due to heat from immune deficiency or blood deficiency. Cautions and contraindications are: use caution in cases with tidal fever from immune deficiency. Use this formula for the following Western medical illnesses: perimenstrual and postpartum fevers, dysfunctional uterine bleeding, various types of anemia, thrombocytopenic purpura, leukopenia, non-healing sores, and ulcers. Some modifications are: for ulcerated sores, add Jinyanhua and Gansao, or for bleeding due to qi failing to hold the blood, add Shanhesao and Shui Yutan. Formulas that tonify the qi and the blood. Bajin Tang, 8 treasure decoction, all ingredients: Renshen, 6 to 9 grams, Baiju, 9 to 12 grams, Fuling, 12 to 15 grams, Jigansao, 3 to 6 grams, Shudihuang, 15 to 18 grams, Baishao, 12 to 15 grams, Dangwei, 12 to 15 grams, Chuanshong, 6 to 9 grams. Tonifies and augments the qi and the blood. Indications are pale and sallow complexions, palpitations, anxiety, loss of appetite, shortness of breath, laconic speech, tired extremities, lightheadedness, vertigo. Tongue is pale with white coating. Pulse is thin and frail or large and deficient and without strength. This formula is for both deficiency of qi and blood. Use this formula for the following Western medical illnesses: various types of anemia, chronic hepatitis, uterine bleeding, habitual miscarriage, non-healing ulcers, and nervous exhaustion or fatigue. Modifications: for insomnia, add Swansauren and Qingren. For stomach deficiency with lack of appetite, add Shaoren and Shenchu. Sichuan Dabutang, all-inclusive great tonifying decoction. All ingredients: Renshen, 6 to 9 grams, Baiju, 9 to 12 grams, Fuling, 12 to 15 grams, Jigansao, 3 to 6 grams, Shu Dihuang, 15 to 18 grams, Baishao, 12 to 15 grams, Dangwei, 12 to 15 grams, Chuanshong, 6 to 9 grams, Rugui, 6 to 9 grams, Huang Qi, 15 to 18 grams. Warms and tonifies the qi and the blood. Indications: pale complexion, fatigue, lack of appetite, dizziness, dyspnea, palpitations, spontaneous sweating, night sweating, cold extremities, spermaturia. The tongue is pale and the pulse is thin and frail. Use this formula for sores that don't heal. Use this formula for irregular periods or continuous spotting from uterine bleeding. This formula is a combination of Qi and blood deficiency. Use this formula for the following Western indications: different types of anemia, nervous exhaustion, non-healing sores and non-healing ulcers. Use it together with chemotherapy and radiation therapy. Use this formula to improve post-operative recovery. Can be used for chronic urticaria. Some modifications are: for heart palpitations, add Wu Wei Zi and Xuan Cao Ren. For severe sweating, add Muli and Long Gu. For lung and heart yin deficiency, in chronic conditions, add Yuan Ji, Wu Wei Zi, and Ji Ke. Gui Pi Tongue, restore the spleen decoction. All ingredients: Ren Shen 3 to 6 grams, Chao Huang Qi 9 to 12 grams, Baiju 9 to 12 grams, Fuling 9 to 12 grams, Xuan Cao Ren 9 to 12 grams, Long Yan Ru 6 to 9 grams, Mu Sheng 3 to 6 grams, Zhigan Sao 3 to 6 grams, Dang Gui 6 to 9 grams, Yuan Ji 3 to 6 grams. Augments the Qi, tonifies blood, strengthens the spleen, and nourishes the heart. Indications are: palpitations, forgetfulness, anxiety, insomnia, dream-disturbed sleep, phobias, feverishness, lack of appetite, pale complexion. Tongue is pale with a thin white coating. Pulse is thin and frail. Use this formula for chronic bleeding syndromes. Use it for periods with copious pale blood or prolonged bleeding. Use this formula for some of the following Western medical illnesses: gynecological problems such as cervicitis or dysfunctional uterine bleeding, and use it for digestive disorders such as peptic ulcers and psycho-emotional disorders, depression, anxiety. Can be used for myasthenia gravis and nervous exhaustion, thrombocytopenic or allergic purpura. Can be used for cardiovascular system disorders such as congestive heart disease and supraventricular tachycardia. Can be used during perimenopause, used for insomnia, and used for the treatment of addictions. Has been used for Meniere's disease and diabetes and hypertension. Some modifications are: numbness in the upper extremities, add Qianghu and Chuansheng. For numbness in the lower back and lower extremities, add Wailing Shen, Duhuo, and Nushi. For painful menstruations with clots, add Yujin and Changfu. For dark menstrual blood, add Honghua, Mudanpi, and Jishi. For menstruation that changes in volume and flows continuously, add Shanzhuyu and Wu Weizi. Formulas that tonify the yin: Liu Wei Di Huangwan, 6-ingredient pill with Rehmannia. All ingredients: Shu Di Huang 240 grams, Shanzhuyu 120 grams, Shanyao 120 grams, Fuling 90 grams, Mudampi 90 grams, Zixie 90 grams. Enriches the yin and nourishes the kidneys. Indications are: soreness and weakness of the lower back, lightheadedness, vertigo, tinnitus, diminished hearing, night sweating, and spontaneous and nocturnal emissions. Tongue is red with scanty coating. Pulse is rapid and thin. Other indications may be 5-center heat, chronic dry and sore throat, toothache, or wasting and thirsting disorder. The formula is for kidney and liver yin deficiency. Cautions and contraindications are: use with cautions in case of indigestion or diarrhea due to spleen deficiency. Use this formula for the following Western medical illnesses: chronic nephritis, prostate diseases, glomerulonephritis, urinary tract infections, and renal tuberculosis. Can be used for endocrine disorders such as diabetes mellitus, hyperthyroidism, and diabetes insipidus. Can be used for hypertension, arteriosclerosis, and coronary artery disease. Can be used for menopausal symptoms and dysfunctional uterine bleeding. Can be used for cataracts, glaucoma, central retinopathy, optic nerve atrophy, and optic neuritis. Can be used for neurasthenia, pulmonary tuberculosis, chronic hepatitis, cirrhosis, and failure to thrive syndrome. Some modifications are: for severe depletion of fluids with heat signs, remove Sheng Di Huang and add Shu Di Huang. For wasting and thirsting disorder, remove Xie Xie and add Tianhua Fen. For spleen deficiency, add Baizhu, Sha Ren, and Chen Pi. For hypertension, add Sangye, Dilong, and Niu Shi. For irregular menstruation, add Aiye and Shang Fu. Zuogui 1. Restore the left kidney pill. All ingredients: Shu Di Huang, 240 grams. Shanyao, 120 grams. Gu Qi, 120 grams. Shan Zhuyu, 120 grams. Ju Xuan Niu Shi, 90 grams. Tu Xi, 120 grams. Lu Jiao Jiao, 120 grams. Gui Bun Jiao, 120 grams. Nourishes the yin, enriches the kidneys, fills the essence, and augments the marrow. Indications are lightheadedness, vertigo, tinnitus, soreness and weakness of the lower back and legs. Spontaneous and nocturnal emissions, spontaneous sweating, night sweating, dry mouth, dry throat, thirst. Tongue is red and shiny, pulse is thin and rapid. This formula is for true yin deficiency and essence and marrow depletion. Use this formula for the following Western medical illnesses: chronic bronchitis, chronic nephritis, hypertension, lumbar strain, and infertility. Some modifications are: for spontaneous emissions, remove Chuan Niu Qi. For deficiency of true yin with flaring of fire, remove Gu Qi Tzi and Gui Ban Jiao, and add Nu Shen Tzi and Mai Men Dong. For night sweats, add Di Gu Pi. For dry stools, add Tu Si Tzi and Ru Kong Rong. For qi deficiency, add Ren Shen. Formulas that warm and tonify the yang. Yugui 1. Restore the right kidney pill. All ingredients: Futsi, 60 to 180 grams. Rugwe, 60 to 120 grams. Lu Jiao Jiao, 120 grams. Shudi Huang, 240 grams. Shan Zhuyu, 90 grams. Chao Shanyao, 120 grams. Chao Guchitsi, 120 grams. Tu Sitsi, 120 grams. Du Zhong, 120 grams. Dangui, 90 grams. Warms and tonifies the kidney yang and replenishes the essence, tonifies the blood. Indications are exhaustion from long-term illness, aversion to cold extremities, impotence, spermaturia, pain and aching and weakness of the low back and the knees, infertility, loose stools, incontinence, edema of the lower extremities. This formula is for kidney yang deficiency. Use this formula for the following Western medical illnesses: nephrotic syndrome, osteoporosis, infertility, different types of anemia, leukopenia, asthma, incontinence. Some modifications are for yang deficiency with spermaturia or turbid leukorrhea and pasty stools. Add wine-treated buguji. For incessant diarrhea, add wu wei zi and ru du ku. For impotence, add ba ji qian and ru kong rong. Shen qi wan, or kidney qi pill, also known as jingui shen qi wan. All ingredients: sheng di huang, 24 grams. Shan zhuyu, 12 grams. Shan yao, 12 grams. Bao futsi, 3 grams. Gui ji, 3 grams. Zi xie, 9 grams. Fu ling, 9 grams. Mudan pi, 9 grams. Warms and tonifies the kidney yang. Indications are lower back pain and weakness, weakness of the lower extremities, a cold sensation in the lower half of the body, tenseness in the lower abdomen. Tongue is pale and swollen with a thin, white and moist coating. Pulse is empty or frail. Other indications may be irritability, difficulty lying down, and urinary difficulty with edema or excessive urination, sometimes incontinence. Use this formula for the following Western illnesses: endocrine disorders, such as diabetes mellitus, hyperaldosteronism, hypothyroidism, perimenopausal syndromes, Addison's disease. Urinary disorders such as chronic glomerular interstitial or diffuse nephritis, pyelonephritis, renal tuberculosis, renal stones, cystitis, chronic urethritis, benign prostatic hypertrophy, and paralysis of the detrusor muscle, postpartum urinary retention, post-surgical urinary incontinence, urinary retention from spinal cord injuries. Can also be used for disorders of eyes, ears, and nose and throat, cataracts, glaucoma, chronic rhinitis, tonsillitis, Meniere's disease, neurogenic tinnitus, periodontal disease. Can also be used for genital disorders, including erectile dysfunction, premature ejaculation, infertility, and dysmenorrhea. Can also be used in respiratory diseases such as bronchial asthma and emphysema and chronic bronchitis. Some modifications are to strengthen tonifying effect, add Rogway and Gueji. For nighttime urination, add Wuweitsi. For frequent, copious, and clear urination, add Bulguji and Lurong. For impotence, add Rukongrong and Guchitsi. For painful and dribbling urination, add Chen Xiang and Lurong. For incontinence or turbid urine after overuse of excessively bitter and cold herbs, remove Zixie and add Wuweitsi. For edema of the lower extremities, combine with Wu Pi Yin.